There are three hidden areas on X-ray that we usually miss. Number one is apex, second one is hilum, and third one near diaphragm. So myself, Dr. Harendra Kumar, Lung Super Specialty Center, Meerut, and we are running a Pulmokranti platform on the Facebook. So if you see this X-ray is classical suggestive of one important diagnosis, and that you can see here, the left lower zone mass lesion. And this area, if you can appreciate, there is some fibrotic opacity in the apical region, whereas the round opacity in the left lower lobe. So if you look at this, so the differential becomes whether it is post-infective, whether it is post-infective. So many things you can miss after looking this, because the differential diagnosis becomes the old changes. But when you look at this lesion, so it's a round opacity. It's a round opacity. So what are the differential diagnoses? First one is it can be mass, whether benign or malignant, but chances of malignancy, they are very less. But round, classical round borders, so benign etiology is highly suspicious. Other one is the round pneumonia. Or you can see the post tubercular changes. There are some nodular opacities, mass like opacities, the granuloma that healed on X-ray. You sometimes see such kind of opacities. But what are the major differentiating point, whether it is malignancy, whether it is post-infective? So I tell you the one important clue that hints you towards the malignancy, and that is a classical symptom of chest pain. So this patient was of 55-year-old female, presented with classical left-sided chest pain. There was no history of past tubercular. So when we did CT chest, there was a 4 into 5 into 3 centimeter mass lesion, and hence the patient referred for further workup of malignancy. So the important message from this video is never miss out any opacity on X-ray. And the most three important areas where we can miss, it is apex, hilum, and the diaphragm. You can easily appreciate the white opacities in the lung parenchyma, but we tend to forget, we tend to lose our concentration when the lesions are in the apex or in the hilum or below the diaphragm, near the diaphragm. So train yourself accordingly. Always look towards the apex, hilum, and diaphragm. You will definitely find important pathologies, and the most important diagnosis of malignancy usually we find in the apex, hilum, and diaphragm. So thank you so much for such informative videos. You can subscribe and follow my channel. So thank you.